very unique to have a university sort of develop a bigger vision for its place in society.
For all of us that do the work that we do in this field, we're adding to what they're calling the rebirth of Detroit.
We're very interested in how the environment shapes brain development in children, particularly relating to their emotional development and their emotional wellness. And what we're finding out is that there are systems in the brain that respond differently in children that have experienced great amounts of stress.
The particular populations that we study, that we work with, are children with depression, bipolar disorder, children with anxiety, obsessive-compulsive disorder.
One of the biggest issues in Southeast Michigan, Detroit specifically, is premature cardiovascular disease. A lot of that cardiovascular disease can be traced to hypertension, high blood pressure. The patients that we see are 20 years younger than the national average. So if the national average of a heart failure patient is about 75, 76, in Detroit it's about 54.
So when we look at our epidemics, they pretty much either start during that adolescent or young adult age through their health behaviors. So that was something that I wanted to address. That was a gap where they're supposed to be learning these skills before they get to the diabetes, before they get to hypertension.
These problems are very multidisciplinary in nature and so do require the attention of a lot of different individuals from different backgrounds to try to address them.
The research, we start here and then we move it out to a national level, hoping to be a model for the other things that are going on.
One of the big thrusts of Wayne State going forward is going to be to improve health equity and reduce healthcare disparities, health disparities in Southeast Michigan by really focusing on the city of Detroit.
All of the students that will come through using the same formula of researching, implementing evidence-based practice, and having outcomes that show improvement in all varieties of health disparity. These students are coming through and they are addressing heart failure, diabetes.
It's building that next generation and seeing those students go out and succeed, develop new technologies, do their own research, and produce new knowledge that really makes this exciting.
Wayne State has distinguished itself because of the people it's able to attract, and in part because it has a unique infrastructure that you're not going to find anywhere else.
The researchers at this university are in the community. They're out there doing the work. They're out there trying to lessen the health disparities that are out there. So the Wayne State plays, I think, a big role in that.
I really don't believe that I could do the research that I'm doing as well or have the successes that we've had in any other environment. And part of that is because we do work in an urban setting where individuals are facing very, very significant challenges.
We are the only gerontology institute that has that dual commitment, not only to research, but also that strong community engagement, like the Carnegie ratings that Wayne State University has. And so Wayne becomes a very important place.
For me, staying here and doing my work here is like giving back to me. It's my community. I grew up in the city of Detroit.
Wayne State's integral to this community because the community needs to know they have an institution that has their back.
And we are right here in the city of Detroit, surrounded by all of this potential. What I try to present is that we're not just a school. We're not just here, just as an education piece, but we genuinely care.